Well, welcome to the Drive Time Talk. I'm headed home, and I wanted to talk a moment about omega-3 fatty acids and longevity, actually. One of the tenets behind a long life is to actually not die from things like cardiovascular disease, heart attacks, strokes, all that kind of stuff. And if you read the Blue Zones, one of the things that they saw across all the Blue Zones was that these people had 8% or higher omega-3 fatty acids, and that's a combination of EPA and DHA. The reason why these things are so very important is because omega-3s actually help, let's keep it simple, they keep the blood from sticking together. They're very anti-inflammatory, and that's the big thing. I actually use omega-3 fatty acids in my chiropractic practice to help people with back pain and things of that nature. We actually use it with our neuropathy patients to help with regeneration of nerves. Your body uses those lipids for everything, and you need good combinations of omega-3s. Actually, you need omega-3, 6s, and 9s. But the typical American gets tons of 6s and 9s. We do not get a good amount of omega-3 fatty acids. So EPA has been linked to all kinds of issues. It helps lower triglycerides. It helps your HDL and LDL ratio. It does all kinds of things. DHA is actually very important for the brain, especially in children, and more research keeps coming out about it in conjunction with Alzheimer's and dementia and neurodegenerative diseases. So with that all in mind, omega-3 fatty acids are very important to know. You need to know what your level is. You need to know how you can actually raise your omega-3 fatty acids. It's a pretty simple thing. If you have questions about where your omega-3 fatty acids are, the testing for that is actually relatively inexpensive. We actually do a test for omega-3 fatty acids and vitamin D for $200, and that will give you what you need to know, where you're at, and how long you need to take a more than maintenance dose of omega-3s so that you can keep your blood from sticking. And remember, I'm oversimplifying this. There's a lot that goes into the pathways of how the omega-3s and how the omega-6s and 9s, how they go down. The big thing is, very simply, there's a end product for the 6s and 9s called arachidonic acid, and this is very pro-inflammatory. It causes the blood cells to stick together, to clot, essentially. And so you really want to know where these things are. And with that being said, it's very, very, very important that you get omega-3s in your diet. And so my omega-3 level, I sit between 9 and 10, and that's where I like to be. Your Okinawans, your Sardinians, and these are people who not only live in excess of 100, but function in excess of 100. They are all at that 12 level. So I'm not saying that that's going to get you there. That is one component to get you there. So with that being said, I hope you all are having a great evening, and we will see you next time.